Hey y'all, so it's Lanice and I'm here with another video. For those of you that are new to my channel, my name is Lanice. I am an LPN in the state of North Carolina. I have been an LPN since 2014 and I am continuing on with my nursing journey, and I'm currently in my last semester of nursing school. And if this is your first time tuning in, I promise I normally have way more energy than I do right now today. However, I'm not going to lie to you guys. I am tired. I am tired. And I'm going to tell you why I am tired. Okay, so today is Sunday. And just to give you an update on how this last semester is going for anyone out there that's thinking about nursing school, or anyone out there that can relate that's currently in nursing school, my week last week was the busiest I have ever had when it came to school. Like the first semester over the summer, I was getting into the groove of nursing school and I was still able to work. Not as much as I am used to working, but I was still able to get about 30, sometimes 40 hours a week. And sometimes I was able to get a little overtime. Then the second semester came. I am in an LPN Transition Program, just to let you guys know that. So I only have 3 semesters that I have to complete to have my RN. So the second semester came and I was having to cut back on work probably about probably about a month into the semester, because it started getting really busy. And then this semester, you know, they told us, you know, your last semester, you are not going to be able to work a full-time job and complete the semester because there's just so much that you have to do. It's like you have to jump through a million hoops to finish nursing school to make it through your last semester. And I thought that they were exaggerating, because they always tell you that. Even in LPN school, they told you can't work while you're in school, and I did it, you know, I really did. But this semester, they told the truth. I mean, you are so busy. And so let me tell you. So last week I had my 12-hour clinical on Monday. I have 12-hour clinicals every Monday, which I actually enjoy, because it gives you the real feel of what well, it might not even be the real feel, but it gives you a good feel, I feel like, as to what it's gonna feel like whenever you get out there and you have to work a 12-hour shift or whatever. So Monday I had my 12-hour clinical. Tuesday I volunteered for 7 hours at my service learning project. So then Wednesday I had class for 4 hours, but then I went to work Wednesday night, and then Thursday I had class, and then I also went to work on Thursday night. So Friday I decided not to work, and Friday I was like, okay, I'm gonna get some rest, because Saturday I had I have one Saturday clinical this semester, and it happens to be last Saturday, the day after Valentine's Day. And let me tell you, this is how I'm gonna tell you that God looks out for you, and how perspective will completely change everything. Let me tell you, because I checked my clinical rotation schedule at the beginning of the semester, and I saw that I had my out rotation the one Saturday on February 15th, and I was like, oh my God, I was so upset, because I wanted to go out and enjoy my Valentine's Day, whether I had somebody or I didn't. I just knew that this year is all about celebrating me, and so I was like, this Valentine's Day I'm gonna enjoy myself. Like, and on top of that, I'm like, why does it have to be on that Saturday? I had something else planned. I actually had tickets to a Wale concert that I bought before the semester even started. So I was like, out of all the Saturdays to have this out rotation, why would it have to be on February 15th? But let me tell you, when God will use the things that you just are like upset about, he will use those things and really, really help you. Because let me tell you, I did not even check to see where my out rotation was going to be. I just knew it was going to be in the ICU. I wasn't sure which hospital. I wasn't sure what floor it was going to be on, what type of ICU or anything. And I was so upset about it, and I was complaining about it every single day since I found out just about that this was going to be the Saturday that I had an out rotation. I really felt like I shouldn't even have a Saturday out rotation, because I told them that I can't do Saturdays. But it's okay. I'm not even mad about it, because let me tell you, God used it for my benefit. Let me continue on with the story. So I didn't even look to see where my out rotation was going to be until 5 o'clock in the morning on Saturday morning. I didn't worry about it too much because I knew that it was going to be at the hospital that I have my clinicals at this semester, but I wasn't sure which floor it was going to be on. And so at 5 o'clock in the morning, I check and I'm like, okay, so it's at the CC ICU. And I didn't even think anything about it. I just saw 7th floor and, you know, it told me which floor to go to. And so I get to clinical on Saturdays, and one of the girls that's in my normal clinical group that I see every week, she was sitting there where she was waiting on Starbucks because they have a Starbucks inside the hospital that we're at. And you know, she was like, what floor are you on? And I'm like, hold on, y'all, I'm sorry. My phone is ringing. Let me finish the video, then I'll call him back. So she asked me what floor I'm on, and I'm like, I'm on 7. And she was like, that's the floor I want to be on. She was like, I want to work on that floor. And I'm like, okay, you know, if you wanted to switch, I'd switch with you. You know, I asked her what floor is she on, and she was on the trauma ICU. And she was like, you know, you're on the cardiac ICU. And so I'm like, okay, well, you know, I get up there and I sit down, and I'm not sure. Let me take a little break, give you a little back history on me and on my brain. So if you've watched any of my videos from last week, I talk about how I have my cardio test next week. Well, this week actually on Wednesday. And I tell you how I can learn any part of the body. You can teach me anything about nursing and I will be fine and I will enjoy learning about it. But when it comes to the heart, I do not like the heart. And I know that that's not good because you will never take care of anyone without a heart. But the heart is just not, me and the heart don't get along. I do not want to be a cardiac nurse. That is not, at least before this clinical, like that was just not a dream of mine. Anytime someone said anything about wanting to be a cardiac nurse, I'm like, you can have it. You can have it. Not even, I will think about anything but cardiac. So whenever I found out on Saturday that I will be on the cardiac critical care unit. And I'm like, oh my gosh, like that is why God made it this Saturday. Even though I had concert tickets, even though it was the day after Valentine's Day, even though I felt like I shouldn't have Saturday clinicals, like he made it the Saturday before my cardiac test because I was so confused about cardiac. But then I went and I was able to, everything that I'm studying right now for my test, I was actually able to see on a person, like really see it. And it was things that I never see because my normal clinicals are on a trauma step down unit, so I don't get to really see anybody that comes in with the STEMI. Sorry, I'm about to hit y'all with the nursing lingo, but I don't get to see anybody that comes in with the STEMI. I don't get to see anyone that comes in and needs mechanical ventilation. Like, I don't get to see any of that, so the only knowledge I have is what I read in a book. And so the Saturday before my test that I absolutely am like worried about because it's the subject matter that I just don't get, I was able to have my out rotation right before that test, and it was like, God, he looked out for the kid because I had so many questions and I had the best nurse. Oh my God, the nurse that I was observing was amazing. Any question I had, they were able to break it down, and if they had questions for me to kind of like pick my brain and see what I know and see what I don't know, if I got the questions wrong, they did not make me feel stupid. Like, it was just a great experience at the cardiac critical care unit. And I'm just like, wow, God really looked out. And let me tell you another way, y'all. I have been seeing and learning faith so much right now in nursing school. Like, nursing school has really taught me faith for real, because I was in a situation, I wasn't in a situation, I don't know why I was gonna start like that, but I was unable to get financial aid this semester. Last semester I was able to get a little financial aid, and you know, I paid for school out of pocket over the summer. But this semester, since I'm not working, I worked 24 hours last week, y'all. So I'm not working like I used to. I'm used to working like 60 hours a week. But so my money is like low, and I'm not used to my money being low because I do work so much, but I understand that I'm investing in myself, and investing in myself requires time, and this time happens to have to be free right now. So, you know, but my money is tight. And so, you know, when I got the letter saying that my financial aid would be canceled, you know, I didn't really worry because God always works things out. And so I was like, well, you know, also, you know, I have a good family. Like, my family is not gonna let me make this far and see that I have to quit because financially I just couldn't afford it. Like, I knew that I was gonna be able to continue on with the program regardless if I had the money and I had to pay it or not. But I didn't want to borrow any money from anybody in my family. Like, I don't want to depend on anybody. I want to do this on my own. So, you know, I got that letter saying my financial aid was canceled and that I would have to pay my tuition out of pocket this semester. And I was just like, wow, you know, like, it was just so last minute, and so, like, it really stunk or whatever. So, you know, I was talking to one of the counselors at my school, and she was like, well, you can apply for this grant, you know, since you only have this one last class that you need to finish the degree, whatever. And I'm like, okay. So I applied for the grant, and y'all, they are paying for all of my tuition this semester. Like, I had to pay absolutely nothing out of pocket this semester, and on top of that, they're paying more than what is required, and then on top of that, I don't have to take out any loans or anything. Like, everything is completely paid for by this grant and by the scholarship. And I'm just like, wow, like, God has looked out for me like tenfold. But anyways, that was a whole video on its own. But I also want to talk to you guys about what I did enjoy about my critical care out rotation also. So what I like about the critical care unit the most was you are required to think. Like, you must know the body at such a small level, is that you basically have to know how the whole body works in order for it to keep going. And it's like, even though you only have 2 patients, they're so critical that you have to continuously be in the room checking on them. Like, you have to be up to date on your nursing knowledge when it comes to medications. I mean, it was just the environment it just made me feel smart. Like, just listening to them, it just made me feel really, really smart, like, being there. My phone's ringing again, sorry. And I also like how quiet it was. You know, the atmosphere, you know, in the ED, I liked the ED because it was so fast-paced, but the ED was loud. It was just very hectic. It wasn't a calm environment at all, because you're trying to get those patients, either trying to stabilize those patients and get them to the floor, or you're trying to just, you know, treat what they're there for. If it's something small, give them the medication that they need and get them out the door. Either way, you know, you're trying to get the turnaround in the ED is supposed to be very fast, whereas on the critical care unit, it's so quiet. They're trying to promote healing, so, you know, it's not gonna be a lot of loud talking. It's not gonna be a lot of flashing lights. Like, it just seemed like it was just kind of peaceful compared to, like, the ED or, you know, the nurses that I see on the med-surg floor that it's just, you know, very hectic. And another thing that I liked about the critical care unit was the fact that you only get 2 patients. Like, you only get 2 patients, and you're able to sit there and you're able to really see those 2 patients. Whereas, you know, on the med-surg floors that I have done, you know, my clinicals on, you might be, the nursing station is in the center and your patients are all the way down the end of the hall. You can't see them. You know, you have to constantly, you have to focus your time in critical care. It's very important that you focus your time, because these people require a lot, but it's like, it's hard to forget about them, because if anything happens, if something is ringing or dinging, you can hear it, you can see it. Whereas on med-surg, like, if your patient's all the way down the hall, you know, and they have a light going off, either a family member has to hit the call light and let you know that it's dinging, or, you know, they have to get your attention somehow, because you might not be able to hear it, or you might not see your patients every hour, or, you know, if you end up spending an hour in one patient's room doing their treatments, that, I mean, it really will put you behind. So, you know, the patient to nurse ratio on critical care, I did like that. And what else did I like about critical care? Also, I liked the fact that a lot of the different things that I see, or a lot of the conditions, excuse me, that I read about in the textbooks or hear about in my lectures that I'm learning about, it was cool to see all of those different things on one patient. You know, it was cool to see the cabbages, and it was cool to, again with the nursing lingo, if anybody's watching this and you're not want to become a nurse, you're probably gonna want to become one after this video. But you got to see everything after it was done, whereas in the ED it was like you know, you're just, like I said, you're just trying to stabilize them. So they might have came in with a heart attack, but you don't get to see the progression of, okay, they had a heart attack and then they went and had a cabbage done, and now I have to take care of them because, you know, it was just a different step in the healing process, I guess you could say. And I like that particular step. You know, I like being able to see them after the surgeries. It was just, I like that. I did. But let me tell you what I did not like, and what I noticed. What I noticed in the ED, and I may be wrong, this may be, I went to the ED and the critical care unit at the same hospital, mind you, and this is also at the same hospital that I do my weekly clinicals at. So this is all in the same hospital. So I might be wrong, but what I noticed while I was working in the ED was it wasn't as much nursing competition. You know, in long-term care, it's a lot of nursing competition. Everybody wants to be the best nurse. Everybody complains about, oh, this person isn't giving all the meds and this person isn't. It's just, they always find something wrong with each other, and it's very catty in long-term care. And also in the ED, I didn't really notice much nursing competition because it was like, who cares how much knowledge you know, because we got to stabilize this person right now. You know what I mean? So it didn't seem like the nurses were in competition with each other. They seemed more like, now they had their cliques, don't get me wrong, but amongst their cliques, like the nurses were there to help each other. They were there to help teach each other and help each other get more knowledge. Whereas on critical care, and this is also something that somebody brought to my attention after I had noticed this, is that most of the people that are in critical care, a lot of those nurses want to get into nursing anesthesiologists, or, you know, they want to move on to become nurse practitioners. And a lot of these programs, in order to move on and get a higher degree in nursing, require you to have critical care experience. So the nurses that are there, most of them want to move up and get into these nursing programs and do those things. So it's like they're in competition with each other, to the fact that it seems like they withhold information from each other, and because they don't want someone else to know, you know, they don't want someone else to maybe be smarter than them, or, and this might be, I might be reaching, but I mean, being that someone else noticed that while I was there, it was like, okay, so it's not just me. It just seemed like the nurses there were very in competition. There were a few nurses that in my area, because like I said, I had a great you know, nurse that I was observing, and the few nurses that he worked with were very, you know, friendly to one another. But outside of that, it was very like, I'm the best nurse, and you know, they don't know this and that. You know, it was just really weird, and I didn't like that vibe about it. And like I said, it may have just been at the hospital that I'm at, but I'm getting a feeling that it's kind of like that in a lot of places, because of the fact that these people are you know, because in all critical cares, you have a lot of nurses who want to move on and get into these hard nurse practitioner programs. So that's what I didn't like about it. Another thing that kind of would make me weary about it is the fact that you have to constantly assess your patients so much. Now, don't get me wrong, you are able to do small assessments. Like, you can check someone's neurological status by just going in and talking to them, asking them a few questions. You can tell if they've become confused. You can tell if they know, you know, if they're alert and oriented, just by talking to them. However, it was like being sure to, it seemed like the nurse had to do a lot of assessments, but the nurse was also required to do the nurse's job and the CNA's job. Whereas like on the med-surg floors, the nurses kind of do mostly their job. Like the CNAs are required to do the bed baths, and the CNAs are required to check the outputs and empty the catheters. And you know, on the cardiac care unit, it seemed like the nurses do all of that. The nurse was responsible for checking the intake and output, and they were responsible for checking that hourly. So I didn't really like that either, because I'm like, well, what do the CNAs do? And don't get me wrong, it wasn't my job to like try to figure out what the CNAs do, but it seemed like the nurse did 100% of the care, and the CNAs just, you know, made the bed or got the rooms ready for the next person that was being that was coming in, or, you know, getting the bed, cleaning the room, not even cleaning the room, but like, you know, taking linen off the beds whenever someone was getting, you know, discharged off the unit. So I didn't like that part of critical care, and maybe that's something that if I were to get into it that I could get used to, but I don't know. I don't think so. So but all in all, I really did enjoy the critical care unit, my out rotation, and it's amazing because honestly, I really and truly for a long time felt like nursing was not for me, because I'm a very big dreamer. I'm a very big thinker. I feel like I'm supposed to be in Hollywood somewhere, and I still do feel like that, but I feel like nursing may just be what gets me there, because it's so many things that you can do as a nurse, and it just honestly, like, being in that atmosphere. Now, don't get me wrong, nurses get burnt out and they might not feel like this always. This might just be how I feel right now in the beginning, but it just feels really good to be amongst other people who are intellectual and who want to care for people. And, you know, just the career of nursing itself is very respectable, and it's, you know, it feels good. Like, it's very, it requires a certain level of intelligence, and it just, I don't know, it just feels good to like be a nurse. Like, and it's crazy because I always thought that nursing was not for me, but this last semester, you know, going to the Children's Advocacy Center and seeing that nurses can do health exams and rape kits and, you know, do that type of stuff, and going to the CCU, going to the ED, you know, it just seeing all these different types of nursing is getting me excited. It's getting me a little confused because I kind of like, for one, I'm the type of person that bounces from here to there. I get bored easily. So, you know, I'm like, I want to try this, I want to try this, I want to try this, I want to try this. And I don't know what I want to do when I get done with school. But I am so excited about all of the opportunities that I'm about to have as a RN. Yo, girl, gonna be a RN. But yeah, so yes, that was how my week went last week, and that's how my critical care out rotation went last week. It was amazing. I loved it. Shout out to my nurse that I was observing. I don't want to say his name because I don't know if I'll get in trouble for that, but he was amazing. If he ever watches this video, he'll know who I'm talking about. And, you know, just shout out to all the nurses out there, all the nursing students out there, everybody that's in your last semester, especially because we're about to be done. So yeah, anyways, but yes, I'm tired and I gotta get back to studying, and I have a lot, y'all. I mean, when I tell you I gotta jump through a lot of hoops this semester, it is a lot. I got clinical paperwork from yesterday that's due tomorrow morning at 9. I got to be at class by 6:30 tomorrow morning. I got a 12-hour clinical. I have my journal from my service learning, my volunteering, due by this Friday, and I have a test on Wednesday that I'm trying to study for. So anybody out there thinking about nursing school, be prepared. Know what you're getting yourself into. It's no such thing as free time. You might have a little free time in the beginning, but once you get to the end, it's over. And let me tell you, you're gonna be tired. I mean, every single person in my class, everybody I talk to, hey, how you doing? I'm tired. I'm tired. We're all like tired. We're excited. We're about to be done, but I'm telling you, like, be prepared. If you're going to get into nursing school, please be prepared. But I'm telling you, like, I cannot wait till I'm done. I know that it will all be worth it. Thank you, God. Like, thank ya. But anyways, my name is Lanice, and I didn't do this in the beginning, but if you like this video, make sure you subscribe, make sure you like, and please share with all your nursing buddies, all your nursing school buddies, all of that. We can all be a team nurse, you know what I mean? Like, just make sure you tell somebody about me, okay? Because I have a goal. I have a goal of 10,000 new subscribers this year, and I need y'all. I need y'all to help me do it. Help me do it now. Help do it, Jesus. Okay, anyways, I'm getting a little too excited. I'm gonna holler at y'all later. I'm out of here. See you later. Peace.